Hello everyone, in this video we are going to talk about safety of chemotherapy in pregnancy. We are going to discuss some of the points only here. So most of the teratogenic drug, they are of a small molecules. So these small molecules can cross the placenta. So there are maximum drugs which can cross the placenta and go to the fetus and make harm to the fetus. Now, risk of teratogenicity. The risk of teratogenicity in first trimester is 10 to 20%, which is not small. The combination of drugs increases the risk. Second and third trimester, if the baby is exposed, if the fetus is exposed to the teratogenic drug, to the malignancy drug, what happens is there is no teratogenicity. Why? Because most of the organogenesis has been happened in first trimester. So teratogenicity will not be there, but growth restriction is there, prematurity is there, and stillbirth is there. Growth restriction, prematurity, and stillbirth is there. Okay, so the risk of these three things happens definitely if the fetus is exposed in second or third trimester. Now, delayed effects are not much or they are rare. What are the delayed effects? For example, if the baby is exposed to the chemotherapy in fetal life and once a time, but after some time, or the effect of that particular teratogenicity or particular effect of that drug comes after some time, that is called delayed effect. The delayed effect is not much here. Here are the direct effect of the chemotherapy and no delayed effect. The exposure to the chemotherapy in the fetal life will actually no data is there which shows that increases the malignancy in the childhood, which was there in radiotherapy. Okay, so here we actually what happens is there are limited studies we have available on these topics. So on this particular situation we have limited studies, and these studies haven't shown any of the risk of increasing childhood malignancies even after exposure to that particular chemotherapy in that particular intrauterine life. Now, decreasing the dose of chemotherapy for safety should not be practiced, because even after decreasing the dose, the risk is not going to be decreased. Okay, so there is no value of decreasing the dose of chemotherapy in view of decreasing the safety. The breast milk or the breastfeeding should be avoided because most of the chemotherapy agents again comes into breast milk. Now, very important side effect is myelosuppression in neonate. So when the baby is exposed intrauterine life to any chemotherapy, that is myelosuppression, this will do bone marrow suppression in the fetus. And once the delivery is happening, when the baby comes outside, this myelosuppression will be there in neonate life. So what should be done when the time of delivery comes nearer? Before 3 weeks, the chemotherapy should be stopped to prevent this myelosuppression. So these are some basic points of safety of chemotherapy in pregnancy. Thank you, friends.